Well, Mark, thank you so much for joining us here today. Give our viewers an introduction to National Access Cannabis.
Sure. So National Access Cannabis is a publicly traded company under the ticker of META, M-E-T-A, on the Toronto Stock Exchange, the Venture Exchange, I should say. We started a couple years ago as a medical company focused on clinics, helping people through the ACMPR. And over time, as recreational cannabis became a potential reality, we got into recreational retail on the legal side and have applied for licenses in different provinces, including in Manitoba through the RFP process. We also are a diversified portfolio company, so we have this Canadian medical clinic model as well as a pharmacy model here in Canada. We also have a biotech division called NAC Bio, and we are expanding medically internationally through pharmacy and clinics across Canada.
Well, it's interesting, here at the Lift & Co Expo, you sat on a panel talking about the Retail Cannabis Control Board and online distribution, looking at the Canadian paradigm. So give us an idea of some of your sentiments related to the current model and perhaps what you might like to see.
Right, well, the model is an interesting one. We have certain provinces where we have retail allowed to be facilitated by private vendors, and we have other markets that we're locked out of with the Crown corporations taking on the responsibility as the retail vendors, both online and of course in physical retail. I guess my opinion is a little bit self-serving in that I feel that it should be done by the private side and not by the Crown corporations. Not that I feel that they're going to do a bad job, more so that I feel that we should be using the private dollars to fund the expansion of this new industry to create access across this very widely distributed country where we have lots of population in rural areas that require access as well, and you know, some very widely held cities as well.
Well, it's interesting, Mark, you know, we're sitting here, it's before July, that July benchmark of the Canadian government has put in place. Given that sort of uncertainty right now, I think that lies around the legislative framework and that excitement that exists, how do you sort of operate, how do you navigate that as a company that's been in business for quite a while?
Well, it started with a lot of government relations work, a lot of meetings that we held to both share our vision of the best models going forward and to understand with different levels of government from federal, provincial, and municipal what their visions of the future were. And through that government relations work, we started to see the picture of what was coming to help us make our business decisions in a way that we felt would be right for our investors. There's been some great things that we've done that serendipitously have worked, like partnering with the First Nations in Manitoba. We had no idea that the RFP would come out and say, score high for your involvement with First Nations. We'd already had that in the works.
What's next for NAC? What do shareholders have to look forward to over the next few months?
Yeah, we're really interested in expanding our medical model. I think that the average investor hasn't paid enough attention to the medical side of the opportunity. There's so much hype around the recreational side, which of course we're going to be a leader in with as much market share as we possibly can have, especially in Western Canada. When it comes to medical, though, there's a tremendous opportunity domestically and internationally. So our feeling is to diversify, to create a diversified portfolio under the vehicle of National Access Cannabis as well as META in order to take advantage of opportunities in different countries and different aspects of the horizontal integration of this space. There's a tremendous amount of intellectual property that we already have. We have business systems, we have you know, brands, we have relationships, and this can be exported as we have the same relationships trying to export their value proposition across into Germany, into Australia, into other countries as well. So I think for us, diversification is very important, especially considering there are only certain provinces where we will have opportunity on the rec side, but there's unlimited opportunity on the medical side. So diversification.
Wonderful. Thanks so much, Mark.
Yeah, my pleasure.